Emergency departments all across the state and the country have spent a year and a half fighting the COVID-19 pandemic. But medical professionals say they're also fighting another pandemic, gun violence. We're taking an in-depth look at it for you tonight. News Channel 5's Kelsey Gibbs talked with a doctor at Vanderbilt who says the department has seen a big uptick in patients.
Things have been crazy.
Since the start of the pandemic, emergency rooms have been seeing more and more patients.
Our volume has been really the highest it's ever been. We're seeing somewhere between probably 10 and 20% more patients than we did pre-pandemic.
Dr. Tyler Barrett is the Executive Medical Director of Emergency Services at Vanderbilt University Medical Center.
We're seeing a ton of COVID-related patients. We're seeing patients with a lot of other kind of medical conditions. And our trauma volume really never dropped off at all.
Emergency departments across the country say they're fighting two pandemics, COVID and gunshot victims.
Compared to 2019, like pre-pandemic times, we're seeing about 20 more patients a month related to gunshot wounds.
In September 2021, Vanderbilt's Trauma Center treated 63 gunshot victims, a 1-point jump from the year before. But in 2019, only 41 people were treated for gunshot wounds.
We were seeing about 35 to 40 patients. Now we're seeing 60 or more, and that's just here in the adult ED.
And when it comes to COVID, Barrett says the trend is going down a bit, but they're seeing about 30 patients come in with coronavirus complications every day.
About 85% of the patients that we're seeing who get really sick with COVID and have to be hospitalized are not vaccinated.
Some may say these two pandemics are preventable. Barrett says all this can cause strain on a busy staff, but he says they're working hard every day to save lives.
Fortunately here, we've got an unbelievable team, both in the emergency department and our trauma service, who really perform miracles.
Kelsey Gibbs, News Channel 5.